As the pandemic spreads, state officials are sounding the alarm that not enough doctors and nurses are available to meet the growing needs of patients. That has meant an all-hands-on-deck approach in some parts of the country. Rules and regulations are now being lifted or changed to allow medical students to graduate early and to enable retired doctors to return to the profession. We heard from many of them, and Lisa is with us again to tell their stories.
This week, desperate pleas for medical reinforcements went out from many of the nation's governors.
Administrators, doctors, nurses, we are calling on you to step up and step in and meet this moment.
We need to have folks who are willing to come return to service.
If you don't have a health care crisis in your community, please come help us in New York now.
New York Governor Andrew Cuomo said 1 million additional healthcare professionals would soon be needed there, a state that has become the epicenter of the pandemic in the U.S.
I'm volunteering because this is the way that I can continue to give back, to New York City. I'm a lifelong New Yorker.
Dr. Jane Bedell spent years treating sick patients during the AIDS crisis and for several decades was a primary care physician and public health official in the Bronx. She retired in February and was set for a trip to Wyoming with her son this week.
I had planned kind of a very unstructured, kind of lackadaisical approach to retirement, honestly.
But 2 weeks ago, the 63-year-old scrapped those plans and instead signed up for the New York City Medical Reserve Corps.
I feel compelled, even in retirement, to step a little bit forward in this moment and to give back in whatever small way that I can and to join with my city in this response.
Another potential source of help, immigrant doctors. Some states like New York and New Jersey are granting immigrant doctors who fall short of some requirements temporary licenses. The Migration Policy Institute estimates some 165,000 health workers who were foreign-born have skills that aren't fully utilized because of rules requiring them to relicense or retrain. And in states with some of the highest numbers of cases, medical schools are now rushing to graduate students early and assigning them to hospitals most in need.
I just virtually graduated from medical school.
On Tuesday, Lauren Caldwell became a doctor while sitting in front of a computer for the University of Massachusetts Medical School's entirely online graduation. She missed the chance to walk across the stage in a cap and gown, but her training will be put to immediate use in one of the university's healthcare facilities.
I'm full of emotions. I don't know if I should be excited, happy.
This definitely isn't how I imagined it, but I'm really excited.
Dr. Taylor Shortsleeve is one of Caldwell's classmates. He feels both enthusiasm and uncertainty right now.
My mom's an NP, and she does primary care. She's particularly worried about me because, the mother-son relationship. She doesn't want me to come down with the coronavirus. I had asthma as a kid, so I'm a little worried myself. But other than that, I kind of quell everyone's fears by saying we're going to be protected, and this is my calling. This is what I want to do.
Newly graduated doctors likely won't see the most critically ill patients, but some other young doctors are already in the thick of it and are being put to the test.
Nobody ever thinks that they're going to go into residency and get hit, by a pandemic.
Reina Gonzalez came to New York from Puerto Rico 2 years ago to start her residency in internal medicine at Mount Sinai Beth Israel Hospital.
I've been receiving a lot of these patients. It's really tough because they come really short of breath. They really say, I can't breathe. I can't control this fever. Being with that first patient, when I'm I really want to help you, but at the same time, I don't know what you have. I don't know how this can affect me, my life, my loved ones. It's the uncertainty, not knowing. We're doctors, we're researchers, we're scientists. We're used to knowing, having the answers, and not knowing. It's something we're not used to, at least I'm not used to.
For older doctors like Dr. Bedell, some of the personal risks are even higher, especially since she's a recent cancer survivor with hypertension.
My family put a lot of work into my recovery, for which I am forever thankful, and my neighbors and my friends. And This might just piss them off if I got sick.
That's why some have questioned whether it's prudent for retired doctors to come back. Dr. Bedell says she'll likely not be assigned to high-risk jobs, but instead offer support to take pressure off of other doctors.
I don't want to clog up an emergency room spot or a hospital bed or, oh my goodness, no, do not have anyone on a ventilator that you could have prevented from using that unbelievable, valuable resource.
These will be our first days and weeks as doctors.
But for graduating students like Columbia's Maggie Bogardus, the crisis offers a unique opportunity, and she says she's grateful to serve in this moment.
What I'm going to take with me is how much it's brought people, specifically in the health world, together. I have been seeing and hearing really incredible things and unprecedented things in terms of what people are willing to do and how they're willing to help. That's why we're here, and that's why we're doing what we're doing. I think it's a really poignant reminder as we're starting off on our careers.
For the PBS NewsHour, I'm Lisa Desjardins.